Live.
Hey everyone, here we are again with another Kickin It With Kerry. I have Dr. McNeill here, and we're going to discuss something that's just, every single human person, well, maybe not everyone, but like 99% of the population deals with underarm perspiration, okay? Some people have it just normal and they use antiperspirant and there's no excess, and some people have a little excessive perspiration, and those people come to see Dr. McNeill or one of our other providers looking for solutions to kind of help them. So, Dr. McNeill, what are some common issues people complain of with perspiration?
So in general, like you said, most people can use the over-the-counter type of antiperspirants, and that's great. But if your sweating is enough that those kind of aren't working, we have some prescription options and procedures that can be helpful. Generally, the first thing we might suggest for somebody who has this complaint, which we call hyperhidrosis, just excessive sweating, is one of these prescription medications. There's Drysol, which is aluminum chloride. It can be applied topically to the armpits. Generally, we would apply it nightly for a week or 2 weeks. It'll reduce sweating, and then you can kind of cut back on the frequency of applications, and it will continue to reduce sweating. Another option is Qbrexza. That's newer. It comes in cloths, so it's easier. You just take a cloth and wipe it on and then throw it away. So it's a little bit easier to apply. That one's glycopyrronium, but both of them basically reduce sweating. This one's like a liquid with this topical thing. The trouble is both of them are sting a lot. So especially in a female who's shaving the armpits, and then if you apply it, it can really, really, really sting. Those are the main drawbacks of them. And the other drawback is that sometimes it's just not quite effective enough. Like it reduces it, but their shirts are still getting wet or whatever. So then that's when we usually go to the injectable treatments. Any of the toxins will work: Botox, Xeomin, Jeuveau, or Dysport. Usually I use Xeomin, and that's what we'll do today on Kate. She's used. You've used both of them, right?
I haven't used Drysol.
Okay.
I don't think I've probably tried it, but I like Qbrexza better. I think it stings less.
Yeah. And this one comes as a brand name Certain Dry, the same ingredient, so you might have used that one.
And I just wanted to point out, I haven't had this issue, but it's really common, isn't it?
Mm-hmm. And you can't wear certain things, like you can't wear this because it would be wet here if you have hyperhidrosis, and so you often have to sort of think ahead about what you're going to be doing that day and what you can wear, so that you plan if you might be getting hot or have to talk in front of a group of people or something. That those are triggers for even more sweating, and then you have to sort of plan your wardrobe around it often.
And any moms or dads out there that have teenagers that are complaining of this, Kate, how would you say it affected you, your kind of self-esteem? Is it something that's been really bothersome to you, or is it something that you're like, no big deal?
I would say it's bothersome. I definitely would plan around not wearing a shirt that's a gray or something, because that would be, you would show the wetness more. So
right.
That's inconvenient for sure.
Yeah. All right, and relatively simple treatment with toxin.
Yeah, it sounds scary, like putting needles in your armpits, but it's generally a very very comfortable, very fast procedure. You'll see, we'll do it in a minute here. You don't even have topical numbing on. It's really not that uncomfortable, that area, to get injected, and it goes pretty quick. And then the onset, it usually starts to work really quickly, even within a couple of days. Like Botox for cosmetic use, or the toxins often take a couple of weeks for the full result. But this, you'll feel a difference, notice a difference within a couple of days. And generally lasts a lot longer too. So usually patients can get a year's benefit from a treatment that's just one day. I usually start with 100 units, 50 units per axilla, per armpit, and like I said.
Why does this work?
It reduces the the eccrine gland function, so the sweat glands. It will reduce sweat production in the armpits, and that's one of the functions of Botox.
Are there any side effects?
I've never had anybody ever have any side effect from Botox for sweat, because we don't have to worry about some of the other side effects that we might worry about, like on the face. If you were too frozen, it could drop your eyebrows or things like that. But we don't have to worry about the muscle function in the armpit. So we're not really using enough where we would be worried about any systemic effect. So very, very safe to do in the armpits.
And then with like when somebody comes in for toxin on their forehead or their on their face, it's usually $14 a unit for Botox or Xeomin or Jeuveau. But is it the same price when it's in the axilla?
For hyperhidrosis, we do a 100 unit treatment, and it's $1,000. So it's a flat rate for treatment of hyperhidrosis. And generally, people can get about a year's benefit from that. I have a couple of patients that need a little bit more than 100 units, so they pay a little bit extra. But for almost everybody, 100 units is adequate, and they will get approximately a year's benefit from it.
And no more antiperspirant after that? Like you don't have to wear that?
I wouldn't say none. There's certainly less need for antiperspirant. Generally, if you do this and you apply antiperspirant, you would have no trouble with sweating at all. Some people don't have to use antiperspirant also, but usually the people who do this treatment have, it's a big problem, so they might still have to use some antiperspirant.
Do you think any people do it just because they don't like using antiperspirant?
Absolutely. Yeah, so if you're not really hyperhidrosis, your shirts are getting soaked with sweat, but you just don't want to have to use antiperspirant every day because you have sensitive skin or you don't like that it looks a little white or whatever, then those patients often, since they don't sweat so much to start with, 100 units is enough where they just don't have to use antiperspirant.
Got it.
That's a good point.
Okay, well, cool. Let's see how this is done. Kate, are you nervous?
I'm nervous for my armpits to be on camera.
But
Stay back there.
But
You've had this treatment before. You can tell us how it
Oh
was.
yeah, no, I'm not nervous for the actual injection. I don't think it'll be fine.
I would say, if knowing you're really excited for this
Yeah,
treatment.
I'm excited. I'm very excited.
You can just put your arm behind your head. You could kind of lay your head on your palm of your hand. And I'll just clean here.
Tickled.
And you might have some hair there because you were using the Qbrexza, and it stings when you shave, right?
Yeah, it's definitely uncomfortable to shave.
Start the injection here.
And how does that feel, Kate?
You can definitely tell that there's an injection, but it's not painful.
And like I said, we're using Xeomin here. I'm doing about 5 units per injection site. And we just spread them over the entire area where we have excess sweat.
And so maybe tomorrow, the next day, she'll start to see that improvement.
Exactly.
It's very cool that I'm curious to understand why that takes effect sooner than it does in your
For muscle. Yeah, the various effects of Botox, of any of these toxins, have a different timeline to the onset of action.
I would say I noticed, I have used Botox in my forehead, like on my face, and when I work out, and I'm one of those people that gets really red.
You could switch.
So when I work out, the areas that have been treated with the toxin remain white, and maybe I'm not sweating there.
So the other uses of Botox are for facial flushing. So it'll reduce facial flushing, and it'll reduce sweat, and it'll reduce muscle movement. So yeah, you're getting that benefit for facial flushing. And it can also reduce pore size in the areas that it's used.
I mean, really, we're using toxins for lots of things in the office. Like you just said, the pore size.
Mm-hmm.
You've used microtoxin to possibly try and treat pores on the nose. Is that true?
For pores on the nose and the cheeks, if we use microtox, so smaller amounts of any of the toxins, it will reduced pore size, on the nose or cheeks.
So right now, Dr. McNeill's injecting each site about 5 units. And when you say microtox, is that like 1 unit?
Yeah,
Half a
1 to
unit?
2 units,
And then, so that's one thing. We also do the masseters, right?
Yay!
Yes.
So
that's also
grind my
muscle
teeth.
reduction. Yeah.
And some people will ask for Botox in their jaw, masseters. Well, I guess it's not the jaw because that's bone, but the muscles there.
The jaw muscle.
The jaw
masseter.
muscle to help them decrease, their teeth grinding.
Yeah, so if we inject in the masseter muscles, these muscles of mastication, the ones on the side of the jaw, it will reduce the function of the masseter muscle. So it will decrease people grinding their teeth, and at the same time, since the muscle gets smaller, you'll get a bit of facial slimming. So the cheeks, if they're full, will be more slim.
So many cool uses for toxins. How do you feel, Kate?
That was really easy. It barely hurt. As you can tell, probably I wasn't, moving around. It wasn't super painful. And now I'm not going to sweat as much. So it's a win-win.
Super exciting. All right. Thanks again for joining us, Dr. McNeill. Thank you as always. Kate, great to have you on film. We'll see you next time.